right? Not everybody who gets into medical school is necessarily a nice person, right? It sounds good. It sounds right. Oh, doctors. But, most of my friends were, a lot of people I went to med school were great people, obviously, but not everybody is. So the question is, how do we do a better job demonstrating that compassion, demonstrating care? When I say care, I'm talking about like a love, like an agape love, like a real love, like the type of love where I'm really treating you like you're my dad. I'm really treating you like you're my mom, my sister, my brother. I'm really, really, really treating you like that, right? I'm not gonna rush to get home when you're sick on the hospital bed, right? That's difficult. It's a difficult thing. It's a very difficult thing to pick between getting home to be able to put your baby to sleep at night and staying here for this patient, especially in this day and age of shift work. And things are changing. Things are changing. When I was in training, everybody was pretty much always expected to stay, and you stayed over and you worked hard. You took care of the patient until what you had to do was done. Nowadays, I don't know if it's an expectation or not, but nowadays, culture more and more is becoming shift work. Oh, my shift is over. I'm going to hand it off to you. You figure it out, right? In my opinion, that might decrease the level of care long term, right? It's a difficult thing. I understand the work-life balance and well-being of a physician. I understand all that, but how do you put all that together? How do we really teach our trainees to really care, give as much as they can to the patient, give everything they have to the patient without draining themselves completely? It's a difficult balance, but that's probably the biggest disconnect. And it's a big disconnect for a reason, because it's very difficult to do. You hope you get all the right people into the field of medicine, but at some point, even if you do get the right people, at some point, it's hard to maintain that. You get tired. One of the things I do is I teach doctors. I've got a company that we teach doctors how to write books. I've got stacks of my doctors' books and stuff, and nurses, healthcare professionals, that we've shown them how to write books. And a lot of these books that they've written about are their well-being. It's about wellness, things of that sort, because it's a real thing in healthcare. It's a very real thing in healthcare.